Did you know that Verber Dental Group has its own in-house lab? From ceramics to implants, removables, and more, they continue to strive to provide the ultimate level of craftsmanship through the most modern technology available. To talk more about the dental lab, we welcome back Dr. Michael Verber. Also, Amber Enterline, Verber Dental Group, is sponsoring this segment. Dr. Verber, what made your group decide to have its own dental lab?
Hi, Amy. Thanks for having us back. I think the decision to do a dental lab in-house into our, incorporate that into our dental health system was driven by, a lot of things. We used to use a lot of local dental labs and have really good relationships with local techs. As the industry changed and those labs became national labs that were even outsourcing a lot of the work, us being a relation-driven company wanted to, bring people in. Having all the technologies from 3D printers and mills and softwares under one roof certainly saves patient cost and allows us to do things a lot more efficiently, a lot faster. We can learn together, connecting the lab and the clinicians, looking at the work that we're all doing together through the lab has allowed us to improve our skills. But I think more than anything else, I just love the idea that we can keep these jobs local.
That's terrific. But Amber, let's turn to you. We were mentioning you're into relationships and being personal. So how do you think that this lab helps provide more, customized care and better results?
Customized care is an excellent term. So with having an in-house lab, we're able to work on one-on-one with the doctor, and not just with the doctor, we're able to work with the patient as well. So we're able to give that more better experience and make it personal for the patient with what they want and what they need.
Dr. Verber, how do the doctors in the lab interact?
Well, I think, like what Amber just hit on is really amazing. When, we get all the credit for when we, give a patient a new smile, but it's always the lab techs that have been the hero that are the ones making the teeth of the prosthetics. So bringing them to the forefront in our group where they're interacting with the patients and the doctors and the assistants and hygienists and the whole staff from treatment plan to prototype try-in to delivery, I think enhances that whole process and the final result, both for the tech. I mean, it's exciting for you. I get to work with you chair side, but also the patient. The other thing that's really interesting is the relationship has changed from the doctor being a customer of the lab to the doctor and the lab techs being partners. And what that does is empower the lab tech. So as a customer, I think, a lab would be hesitant to say, hey, the impression you sent us is no good. You need to redo this. We tell them, look, you're in charge. If something isn't 100%, we're putting the patients first. You tell that doctor to redo it. So that is really good for the patient, I think.
Do you like bossing the doctors around?
It's nice. It's rewarding sometimes.
It is rewarding. If somebody's interested in learning more about the lab, maybe being part of the lab, how should they get that information?
So you would go to VerTrueDental.com, and that provides all of our options that you have within the lab. And it has a phone number for you to reach us. If you have any questions, we can answer. So it's a great website you can refer to.
Perfect. Thank you to both of you.
Thank you.
Before we go to break, we thank Verber Dental Group for sponsoring this segment. We will be right back.